All right, good morning, everybody. I'm Kelly Goodman Schaefer, President and CEO of the Bedford County Chamber of Commerce, and we're delighted to have a great panel lined up today to discuss some reopening experiences during the COVID-19 crisis as Bedford County is set to move to the yellow phase. Tomorrow, we do have many businesses that have operated throughout this crisis, either as essential or having had waivers, and I know that they have a lot of a wealth of knowledge and experience to share. We do want to start with just a couple of items of housekeeping. If you would please mute yourself so that everybody can hear. If there's a lot of noise in the background, it makes it hard for everybody to hear other folks talking. So I would ask that you only unmute when you're speaking. Also, I want to make the disclaimer that none of the experiences that are shared today are meant to be legal advice. So this is folks that are very generously sharing their experiences through their own businesses, but a lot of the legalities and litigation aspect of this crisis is yet to be determined. So please don't take what they say as what you should do in your business in terms of legal standpoint, but they are here to share their experiences, and hopefully that will be of benefit to their fellow members as we go into this new yellow phase. So our panelists today, we have Tina Molski, who's Director of Operations of REI. If you want to wave, Tina, so folks can see. Yep, she's Director of Operations at REI. We have Jennifer Nouse, Clinical Director of Nursing at UPMC. And off camera with her is Annette Goddazart, who's also able to maybe chime in a little bit. We have Helen Sickle, Director of Marketing at Homewood at Springhouse Estates, retirement community, and we have Courtney Leydig from FNB. She's branch manager of the two Bedford branches. So I'd like to start, let's start with you, Tina, and just give us kind of a status report of how you guys are doing and maybe a brief overview of what measures you've implemented at REI.
Okay, sure. So I will say overall we're doing well. We're fortunate enough to be considered essential as a location, not as an entire company. So if you're familiar with REI, we've got 168 stores nationwide. We did shut them down, but we were still open for business online. Just like you've seen a lot of other companies, we're really able to support nationwide with online sales. So we've shifted all of our work over to the online support and have done, from a location standpoint, very well. The transition, though, it's really ongoing. It's really understanding what the CDC guidelines are, what PA.gov guidelines are, and continuing to update and adjust accordingly. So if we looked at it in the beginning, we were able to adjust shift times. When masks became mandatory, we're able to very quickly shift into masks. Not super popular with everybody, but I think our folks understand why we were doing it. So from an online support, it's pretty much business as usual. Our retail is still shut down, but we're able to give our folks the hours that they would like, and in some cases more than they would like as we head into our anniversary sale. So I'd say overall, I consider us very, very fortunate. The biggest push, though, is helping people understand and managing people who, you've got folks who think it's a hoax and it's not a big deal, and you've got people who are terrified, and you have everybody in between. And it's being able to have the compassion to listen and help everybody through and hold everybody accountable to the right policies and the right rules.
Okay, thank you, Tina.
Oh, Kelly, you went on mute.
There we go. Sorry, I thought I unmuted myself. Let's go to Jennifer Nouse from UPMC Bedford and hear a little bit about how the hospital has handled the situation from their perspective.
Thanks, Kelly. Actually, we have the fortunate advantage of a lot of the frontline information. So we have a very, very dedicated team of infection preventionists, epidemiologists, corporate group, as well as our local group. So we have implemented all of the safety mechanisms from the very beginning. We've started the masking, the screening, we reduced our visitation and even shut it down for quite some time. We are screening at the doors. to make sure that everyone who enters our facility is safe to be there. And we've taken a lot of measures. We have an incident command team that we enacted right away as part of our emergency operations program. And we've been on call 24/7 for any kind of decision making as the understanding and information evolves throughout the time period. And we continue to make changes. We update the staff. Our staff have been ready. They have not backed down at all. There is very little fear. We are ready to conquer anything that comes our way. And we've been taking care of patients the best way we can. And we're business as usual also.
Thanks, Jennifer. We'll go to Helen Sickle, who is another healthcare institution. Can you talk a little bit about, Helen, what you guys have done? And I know, oh, sorry. Sorry. How have you managed, an independent living facility when everyone can't always be as independent as you'd like through this crisis?
Well, it has been a challenge, but we're very proud of our community staff and residents. And we have shut down visitation for the personal care, and we're not allowing any visitors in the independent living apartments even now. They are independent, so we can't tell them not to go out, but we're strongly recommending that they use precautions, wear their masks, social distance if they need to go out. We've increased our services to them. We deliver mail to the apartment residents daily. Groceries, we do shopping for them that we haven't always done. We have guidance from our corporate office, like the UPMC situation. We're in touch with them on a daily basis, and they have access to information from the CDC and all the governor's information telling us what to do and where to move. And we're just starting to lessen things where in small groups, we're going to allow like maybe 6 people to have coffee if they're sitting at 5 different tables one day next week, or maybe go outside of the pavilion, 6 of them in a 50-foot pavilion that they can sit far enough apart that it's safe. So the challenge is keeping everyone happy, but keep them all safe. And the best thing for us is we have no cases in staff or residents on our campus.
That is very good news. Thank you, Helen. Courtney Leydig from FNB, if you could give us a little overview of what has been going on at the bank. I know you guys have been incredibly busy with PPP, but also, daily bank operations. How have you guys handled things throughout this crisis?
Yes, thanks, Kelly. So we have done some different things. First National Bank senior management across the board reduced hours once our lobbies closed from 9 a.m. to 4 p.m. across our 500 branches that are in many different states to be uniform and give the same kind of experience to every customer that we work with. So currently right now our drive-throughs are operating 9 to 4. We are taking appointments only. It's not that you can't come into the branch. However, we have taken some precautionary measures in that respect where, we do ask that you call in, make the appointment with us. We are asking screening questions. We are requiring that customers do wear masks when they come into the branch. Our staffs are wearing masks as well. We were actually provided, they're called sneeze guards, and they are large pieces of, it's plexiglass on feet, and we have them set up on our our account opening desks and also on our teller line as well. So if we do have to have that interaction with people, even with the mask, we do have that additional shield between us. The one thing that FMB has done, which is greatly appreciated by myself and all of our staff, is that they have sent out, they call them sanitation kits. So they have made sure to supply us with wipes, tissues, hand sanitizer, gloves, things like that. And then once the rules on the masks changed and it was the requirement, they did move forward and they have provided us with both cloth and disposable masks. So, we're running business as usual as well. However, it is, everything is we're trying to handle everything through the drive-through at this time. We do have people coming and making appointments to get into their safety deposit boxes, and but we are, doing the most that we can through our drive-through. So we're protecting not only our customers but my staff as well. So obviously, I know that's a concern for everybody here. It's not just protecting the people that we're serving; it is also protecting ourselves as well. So.
Courtney, just to follow up, I know we expect healthcare workers to maybe be a little more, used to going into these kinds of measures, but bankers probably not so much. So how has your team responded, and have they risen to the challenge, and are there ways that you have recognized them or helped them along through this process?
Actually, yes, my team, I can't say enough about my team and how proud I am of them. They have all stepped up. We also did take on the challenge, not only of, making the changes within our branches and, serving our customers continuing. We also had the additional PPP program go into play for us that we had to handle. So we were fielding lots of extra phone calls and things like that. So my team has definitely risen to the challenge. Everybody has bad days. There's been some times where things have been a little tough in dealing with our customers because not everybody understands the need for this. And if they don't agree, we have had some instances like that. How we've recognized our team members for the work during this time, obviously just the moral support and the congratulations, good job. I liked how you handled that. But also, First National Bank has done some little things for us. Our staff got to wear jeans and casual clothing, during some of these times. We changed footwear. You can wear some more relaxed footwear, which I know that doesn't seem like a big deal, but when you work in the bank all day long, it sometimes can make a difference. The other thing that First National Bank did for all of our team members that were working during this time, there was a certain date in place. They actually gave everybody a $500 bonus on top of their wages. I know some other places have increased wages permanently, but they did give that to us. And that included our all staff, frontline staff, managers, that were actually physically in the branches working. One other measure they did make is that a lot of our underwriting staff, our compliance teams, things like that, they have been working from home. So that was one other thing that they've done to protect everybody as well.
Thanks, Courtney. Tina, would you like to add on to that? What you guys have done at REI as far as, I know you guys have a great culture to begin with of team building, but I would imagine that has been a challenge during this time. So how have you addressed that?
So it has been interesting to lead people through some pretty dramatic change, specifically culturally for us. I would say, we are following all the CDC guidelines, but when I look through a list I put together, we're doing the temp checks, we're doing the health questions, just to really remind folks, we have signs like there's nobody's business throughout. So it's really about creating the visuals, whether it's a reminder to clean your area and sanitize your area before you start at the beginning of the shift, and then do it again at the end of the shift. Is to protect you, but also to protect the person that will work after you later in the day on a different shift. We've got tools for anybody who needs them. So whether it's Clorox wipes, it's spray and paper towels. We listen to our employees. So if you've ever been in our building, we move a lot of product in these really big gray plastic totes. Multiple people touch them, and they just get cycled through and through. And so one of the ideas an employee came up with, can we spray them down through each rotation? And there's plenty of tools that you can buy. You can get the battery powered sprayers. Like, think about something that you would use to spray weeds in your yard. So it's very easy to spray pretty big areas. And that was an employee idea that helps keep a lot of people feeling safer and sanitizes. When I look at the visibility of cleaning, we have a janitorial staff that comes in, and they've really upped what they're doing in our building constantly throughout each shift. So I think that's been really impactful. One of the neater stories of something we've done, though, if you've tried to order anything when it comes to PPE, hand sanitizer, any of that stuff in the last several months, you may have found that it got back ordered, you couldn't find it. You'll get it in September, which is not when you want it. And one of the things we wanted to do was put additional hand washing stations out on our floor. So we ordered some of those kind of camping ones, or the ones that you see maybe at fall foliage right outside the porta potties, those big gray ones. Everything got back ordered. So my facilities team made their own. And they did a really, really nice job with it. You know, it had the touchless soap dispenser, it had the touchless paper towel dispenser, and then they created a way to have a foot pump sink. So we could place these anywhere in our distribution center just to give our folks another opportunity to keep their hands clean. So the creativity has been pretty fantastic in the building, and I've really, really appreciated that. The other thing though we've done is if we don't need a space, we've closed it. So we have a small gym in our facility. Nobody needs to go in there, and that's just a place for people to spread germs. So we shut it down. Smaller conference rooms that we're not going to use, shut it down, and it allows our janitorial team to focus on the areas that people use a lot, as opposed to spreading them out and not getting the other areas touched quite as frequently. So it's a balance of the amenities that you have for your employees, but the number one focus is to keep them safe. And I think we're doing our gosh darndest to make that happen.
Thanks, Tina. Well, speaking of creativity, I know Homewood has done some very creative things in terms of dealings with residents. And Helen, do you want to talk a little bit about some of the things that have gone on your campus?
Has really stepped up. They built, first of all, a mail delivery slot system so that they could compartmentalize everyone's mail and deliver to them. Then they built a bird feeder for outside of the personal care unit in one of the windows so the residents could at least look at that because they were confined to their individual space. We also had them build a plexiglass and wood visitation booth for our personal care area, and it's small enough that it can be in the vestibule, so it's out of the weather. The visitor sits on the outside, the resident is on the inside of the personal care hallway, so they're not leaving the building and the guests aren't coming in. We started using that this last week. We, as everyone else has ramped up, everyone's wearing masks, washing their hands. We also have 2 hand washing stations in addition to the restrooms. Our corporate office has made sure that we had plenty of signage, pumping up the staff, telling them what a great job they're doing. We just got a new sign this week about Heroes Work Here that our sister facility made for us. We've also done deliveries of meals and just now started doing curbside pickup if the public or the cottage residents want to come pick up meal up. We had support from every department for every other department. We're truly a team where everyone's jumping in, doing whatever we have to do. And as Tina said, excuse me, it's difficult wearing a mask all the time, and it gets a little much, but everyone's doing it, and the residents have been really, really good, but they're getting weary. They're getting tired of staying in their apartment and not being able to get together with all their friends.
Thank you, Helen. Jennifer, back up to you. Can you talk a little bit about any kind of creativity the hospital has had to employ during this time? Is there something that you guys have done in special for your teams or anything like that?
So we've done a lot of rewards and recognition for our staff because we recognize how difficult it is to come in during a pandemic. Yes, we are trained for this. Yes, we have all the measures in place, but it's still a very uncertain time, and it's still scary for us regardless of the situation. So we make sure that we really have been trying to make a lot of extra rounds with our staff. We're providing snacks, just little fun snacks out of the blue for them, and free meals, and just trying to throw some things out there that make their days go a little better. We've sent them home when they're not needed. We want to make sure that there's no reason to potentially expose someone, even though we are taking every precaution out there. We still send people home when they're not needed. We had the paid protection program, so people were able to go home and get paid for being at home, which was really nice for them. We really stress that we want to keep our staff safe and healthy for when services all resume. We're ready to go full blast. But it's mostly just thanking them. We have also placed a lot of signage around. Some people have, the community has been amazing in their donations, and we can't thank everyone enough for that. That really tugs at our heartstrings, because we know why we're here. And it's just really special when other people recognize us for that. That it's just, it's really means a lot to us. So I want to throw that out there. Thank you to everyone for that. But we're just going strong, doing what we know, what we need to do. And we've also been doing some cross training of our staff so that they're more flexible to work in any department, so that when things do get really crazy, we have been able to respond to all areas. We work really, really well as a team. This small hospital staff, we are like family, and we have each other's backs. So when one unit has been running around like crazy, another unit steps in and comes to help, and we've done that interchangeably. So it's been working really, really well, and we just are so proud of everyone.
Have you identified a biggest challenge that you have had during this time? What would that be?
Honestly, I would have to say it's just the constant change, because one little change in information sends us through so many hours of planning and trial and error and figuring out and opening this unit, moving things, moving equipment in this area. And then till we get that finished, there's another change in the information or the data that, but we're resilient. That's what we're here for. So, and we're just very dedicated to doing it. So that has been a challenge. It's very tiring, but it's okay, because we're still here and we're going strong.
All of your other panelists nodded their head when you said the constant change is probably the biggest challenge. I think that that's the case for all businesses right now. Back to Courtney. How do you see operations changing now as we move to yellow tomorrow? What kinds of plans do you guys have to sort of phase back into a more normal operation?
So at this time, we have not been given any direction from senior management. We will probably continue to have our lobbies closed. We were told this was indefinite. You know, as you know, to Jen's point, you know, the challenges for the ever-changing information and things like that is, you know, that we've all experienced, has kind of kept us, you know, at the point where we're going to keep the lobbies closed or by appointment only. You know, that itself is a challenge, just because, you know, honestly, we've had customers that have never used a drive up before. They don't even know how to open the tube. They're accustomed to coming into the branch and working with somebody face to face. And, you know, that has been you know, our biggest challenge, working with the customers, getting them to, you know, get back on board with that. But, you know, as of this time, we don't really have any changes that we're going to move forward with in the yellow phase whenever that hits tomorrow. So I think that our senior management is going to kind of keep that, you know, we're going to probably ease back into this slowly. So we're making sure we're doing everything the right way.
I think that's probably very wise from everything that we're hearing in the state news conferences and so forth. The move from red to yellow is much smaller. It's more psychological, I think, than anything, but there's still a lot of precautions that need to be in place and continue. Tina, how do you see your company phasing back into normal operations? And do you see any of the changes that you've implemented being permanent, even post-pandemic?
I do not like that second part of the question. I don't think I like the answer to it. So speaking as REI as a company, it's a slow transition back to what may be our future. So on a good note, Montana, we do have some stores in Montana, and they have a really, really low incident rate from COVID-19. And as a state, they are moving towards reopening. And what we learned in Montana is if you wanted to be considered local, which REI likes to do in any community, you want to align yourself with the other stores. And if every other store is open, how do we open those stores? So it's a slow process. The health and safety of our employees and our customers, so whether it's a distribution center employee or a retail employee or a customer, is always first and foremost for us. So I think we are a little bit slower in reopening than I think some other companies may be. So it's a slow process. Kelly, to that second part of the question of, some of the things that we've implemented, will they last? As much as I want to say no, we are going to go back to high-fiving and hugging and all the things that, are exciting about working with a team of people. It seems to me everything I'm looking on in the news is that social distancing will be part of the norm. So I look in our break rooms. We removed roughly 66% of all the chairs out of our break rooms for breaks and lunches, because people naturally want to sit with one another on their breaks, and helping them understand social distancing isn't just when you work. It's not just when you come in the building. It's at all times, at work and at home. And I think there's something to be said to that will carry forward. There's a lot more products that are being pitched now that are dividers in break rooms for tables, so you can see each other through plexiglass, but there's a divider. You're seeing them selling stuff like that for cubicles. So I think there's unfortunately something to be said that we will not be as touchy-feely as we have been in the past as a community or as a business. Oh, you're on mute, Kelly.
Sorry. Do you have any advice that you would give to fellow members, not from a legal standpoint, but just in general? I think that there's such a wide spectrum of folks, as you mentioned. Some are terrified of trying to get back to normal operations, and some are like a bull ready to get out of a holding pen. So how do you balance that, and what advice would you give to folks as we try to move slowly back to a new normal?
I think it's really about trusting the leaders that you have within your teams. So I look at this building, and I've got over 300 people working in this building, and I can't personally touch base with every single one of them on a regular basis, but I do my best to, walk the floor, check in, how are you doing? I will, openly admit, knowing that you're recording this, that early on, I may have had a minor panic as I walked the floor and I saw people standing too close together, because I was responding, I think, a little bit of ahead because our headquarters is in Washington, and I was part of all of those conversations, and it hadn't really come to central Pennsylvania yet. So it's, I think, being human, being, your real self as you interact with your folks, but also making sure that they know that it truly comes from a place of you caring about their well-being. You're not trying to punish them wearing a mask. You're not trying to punish them by separating them. You're really trying to take care of them. And the best thing you can do is listen. If somebody's struggling because they don't believe it, or they're struggling because they think, the whole world is going to die, listening to them and helping them through those conversations and asking them, what can we do to make you feel better about being here? And then implementing those really goes a long way.
Yeah. Thank you. Helen, you guys have been caring for some of the most vulnerable in our community, and you guys are starting to do things like curbside pickup for the public for lunches out of the cafe. How do you see the transition going for Homewood, and what advice would you give to your fellow members in that regard?
Well, because we are caring for the most vulnerable, we are taking very, very small baby steps. We still want to keep them very safe. We still have no visitation. Even after tomorrow, there are no visitors allowed in the community center or in the personal care unless they're with the shield. We are also going to continue meal delivery, and we're, staff washing their hands and wearing their masks and getting their screening done, pulse ox, temperature. That also happens to home health people or visitors who are permitted to come in, emergency technicians as far as heating, air conditioning, that kind of thing. We don't have directive, as Tina said, and also Courtney and Jennifer, we're waiting for direction from above us as far as like the governor's office and the CDC. And when that comes, it changes everything. And it sometimes comes by piecemeal. So we don't get a whole lot of info at once. We get a little piece, we change it. The corporate office gives us great direction. They try to boost our staff morale. They've provided meals for our staff. Actually, twice it was a family meal that was to feed a family of 4, and they had it delivered here and it was handed out. Our staff are very appreciative. The other thing, I agree with Jennifer, we've had family members appreciating us so much, either verbally or by bringing us candy or sandwiches, that we're taking care of their family because they can't do it. They aren't supposed to be with them. And again, to Tina's point, telling people that the 6-foot thing is not a punishment, it's a safety. That's an issue for the residents too. We have the spectrum of those that are afraid and those that think it's a hoax and they don't understand why we're doing this. Well, it's a directive we've been given from the government and from our corporate office. So we're just doing our best to keep them all safe. And like I said, baby steps to reopen.
Thank you. Courtney, any advice you'd like to share with your fellow members?
Not really. Everybody, oh wait, I think I'm muted.
Nope,
There
you're
I am.
not. You're good.
Just everybody else pretty much took the words out of my mouth. You know, they're all great points. The other panel members made great points, and pretty much my sentiment is the same. You know, it's a take it. I hate to be, you know, just take it slow. You know, obviously we're all getting directives from our senior management, from our corporations, things like that. But it's not something that, you know, to make a decision to do something, it's always good to have a plan in place, which I know us as a corporation and everybody else on the panel, and I'm sure a lot of the other members, they may not have, like we have that, but not everybody has that. But just make sure that you have a plan and make sure that you have, you know, precautions in place, whether it's, you know, following the CDC guidelines, you know, cleaning procedures, you know, work with your staff, talk with your staff, as Tina said, you know, be there for them. The only thing that I would say is that, you know, I know that everybody has differing views on this. You know, some people think it's a hoax, and some people think that, you know, if I go outside, I may, you know, I'm going to catch it and then I will die. You know, there's lots of extremes. However, you know, we have to, I feel the best thing to do with that is that we have to honor everybody's feelings and opinions on that. They're valid because it's what they feel and it's their opinion. And we just have to work, you know, just work with your people, however they're feeling, as best you possibly can, and give them the support.
Thank you. Jennifer, anything you would add to that?
I echo what Courtney mentioned. Take it slow, be smart, be reasonable. I would, if you're just starting out again, take it in small steps, monitor the response, and make changes accordingly. Not everyone is going to respond the same way. Not every business will be responding the same way, but we should all be following the basic principles, very basic principles of infection prevention anyway. You stay home if you're sick, you wash your hands, clean your surfaces, cough into your sleeve. You know, it's basic infection prevention that we would perform with any type of virus. And unfortunately, this is probably not the last virus that we will ever encounter, certainly not the first. And always remember what you've done in the past and know what worked and what didn't work. And don't lose sight of what's really important.
So with this many folks on the call, I will ask that anybody who has a question and maybe put it into the chat, and I will ask it to our panelists. That way we don't have a bunch of mics open and everybody will be able to hear. But as I wait for folks to type any questions in that they might have, if I could just close out with each of you sharing maybe what you view as your greatest success during this crisis. Jen, do you want to start?
Our greatest success is keeping the community safe, keeping our patients and visitors safe, keeping our staff safe. We've, compared to what we expected and what we watched daily, monitored daily as what our projections were, I think we've done an amazing job at keeping this at bay. I hope that that continues, but we have to be realistic also and always be prepared. So our success is our staff and all of their efforts.
Awesome, thank you. Helen, your biggest success, you feel, from Homewood's perspective?
Our biggest success is a healthy campus. We've actually probably gone overboard with the sanitizing and housekeeping staff cleaning everything. But weeks ago, our team said we'd rather overachieve in the cleanliness and the stopping the health spread than to a month ago, oh, we could have done this and saved someone. So we're just proud that the team has stepped up and no one has panicked. There's no panic when you're with seniors and you're trying to re-explain things and make everyone understand and assure the families that we have their best interests at heart and we're doing everything to keep their families safe. And so far, so good.
Courtney, your biggest accomplishment or your biggest success you feel through this?
I just feel that we have still, our biggest success is obviously, like everybody else has said so far, obviously keeping our staff safe and healthy. That's always number one. But you know, our biggest success as a business as a whole, I feel, is that we still serviced our customers. You know, we've had people open accounts, booking loans, the PPP project. You know, everything was very successful, and we continued, we strived to still give our customers the service, the level of service that they're accustomed to coming into the branches. But we did that the best we could, you know, through our drive-through and the other, you know, options that we had in place.
Tina, anything you'd like to add about the successes at REI through this crisis?
I think they've hit on it. I think for us, it really is, to what Courtney said, it's about we're still able to service our customer. Just anecdotally, people are buying a lot of bikes this spring. And I've had people in this building really step up to build a bike that has to be mailed to somebody's house. Most of the times people will pick it up in a store. So I know Walmart has sold out of bikes. I know there's a lot of retailers that are just flying through the bikes, but just the amazing work this team has done. And through it all, I will say my personal biggest success is, though I don't get it from everybody, but when I walk the floor and I have someone say, you know, thank you, we really know that you care and you're keeping us safe. That makes the sleepless nights a little bit more worth it. So from that aspect is, I think, Helen, you said it really well. You know, if we overreacted and we cleaned too much, we did it right, versus, you know, if we're just like, oh, it's not a big deal, it'll go away, and then somebody gets sick. So I'd rather have a sleepless night than a sick employee.
So we have a question from someone on the call about their business includes going into people's homes. And do you have any suggestions or advice for them? They understand about social distancing, but still a little bit concerned about going into home situations. Any suggestions on how soon that might be something to do, and how to maybe alleviate the apprehension for that? And we'd hope to have, I'm sorry, go ahead, Jen.
I wasn't sure if I was still muted.
Yeah, you're good.
I would suggest making sure that the person they're going to see, everyone there is wearing masks, that you're wearing masks, that you are social distancing as much as possible. Keep your hand sanitizer with you. You know, depending, I'm not sure what kind of service this is, or I would say to reduce your duration in the home as much as possible, and to limit as much contact with any surfaces or the person themselves would be my best suggestion right now.
If anyone else has a question, please feel free to either type it into the chat or you can raise your hand and I will unmute you. I wanted to say, while we're waiting to see if there's any other questions, that it's because of the work of the businesses that have been open throughout this time that has helped our community be as safe as it has been. And you know, as we move into a yellow phase, I think we're all very appreciative for all the work that you guys have done. There's been a lot of people who have been able to work through this crisis, and had all of your companies not been doing all the things that you were doing, the rest of our community would not be in the situation that it is, able to move into this yellow phase tomorrow. So I hope that our community and our other businesses follow your lead and allow us to stay in the yellow phase and move toward green, as opposed to moving backwards with the virus spreading more tomorrow and beyond that. So thank you for all that you guys have done to set such a good example and to help keep not just your customers and not just your employees safe, but our whole community. Does anyone have any other questions before we let everybody go?
Hey, Kelly.
Yes.
Just to add to what Jennifer said, I really like that. And then I was thinking, we do health checks before people come into our building. And I would say if you're going into somebody's home, calling the morning of before you go to that home and just asking those questions. Is anybody in the house sick? Is anybody symptomatic? And maybe rescheduling. And again, it all depends on what kind of service that is. But if it's inside the house, I think that's a fair question to ask.
Thank you.
Personal opinion, not legal advice.
Right. Anybody else have anything they'd like to share, their experiences or questions? You're more than welcome to turn on your cameras and microphones. I think that we've gone through the formal part of the program. So if anyone has anything to add or share, you're more than welcome.
Kelly, I just want to thank the Chamber for leading the information charge and dissemination, because people are hungry to know what, on a grassroots level, what to do. And they don't always comprehend or break down what they're hearing from the governor's office or the CDC. So if you've made it on their terms, they can understand it and they know a little more what to do. And I think that's great. So thank you.
Thank you. I would just share that we have put together about a 20-page reopen document that compiles information from the CDC, Department of Health. It has some printable posters if you'd like to put them in your business that remind people to wear masks. That's available on our homepage at bedfordcountychamber.com for download. You can also click through that PDF document to additional resources if you're interested. And I would also mention that the Pennsylvania Chamber has a new website called Bringing PA Back, and that has a lot of information on an industry-specific level. So they have partnered with a lot of industry associations throughout the state, so restaurant and lodging and banking and things like that. So if you're interested in information specific to your industry, you might be able to find it on that website, Bringing PA Back. And the other thing I would say is I think we have such a fantastic community of businesses here, and one of the things I've always been so impressed about Bedford County is how much we want to help each other. So I think that there's always somebody that we can turn to for advice and for support. And if there's something that we can do as a chamber to connect you with somebody in that respect, we certainly do our best to do that. This program has been recorded, so I hope additional people will take advantage of hearing what you all have talked about today. And I would just turn it back over to our panelists for any final comments if you are interested to make them, and then we will let everyone get back on to their Friday business.
So Kelly, I would just say, we've heard it a couple times, but it's listen and say thank you to your folks. And you can say thank you in so many different ways. So it's going to start getting warmer, and apparently for my folks, there's a local dairy that has pretty amazing ice cream sandwiches, so we'll be seeing those on one of our hot days. Thank you goes a long way to folks that put themselves out there to get your business back up and running.
For sure.
I totally agree.
All right. Thank you guys so much for being with us today. Thank you to everybody who logged on. We do have another call coming up at 11 o'clock, and that's in conjunction with the Cambria County Chamber of Commerce. So if you'd like to join in for a conversation with maybe some different businesses, you're more than welcome to join us at 11 a.m. And that information is on our Facebook page as well as all of our emails. So thank you for being with us today. Have a wonderful and safe weekend, and we look forward to seeing you all soon in person. Bye-bye.
Bye, everybody.
You too.